Hello, and welcome to the HDSA Caregivers Corner webinar series. Today, before I invite the presenter to get started, I'm going to briefly go over how to ask a question as well as how to access this webinar after broadcast. As in all of our webinars, we're going to answer the questions following the official presentation. However, you can send in your questions at any time. To send in a question, go to the control panel that appears on the right-hand side of your screen, type your question into the panel, and hit the send button. This webinar will be available for viewing approximately 1 week after broadcast, and you'll be able to access it on the HDSA national website, www.hdsa.org. To access this presentation, go to the HDSA website, scroll down to the homepage, the frequently used shortcuts section on the right-hand side. You see a link to the Caregivers Corner webinar series as well as to the PowerPoint presentations. You can also see the older webinars archived in Living with HD section. And now I'm pleased to welcome Amy Cheshire, who will talk about family dynamics in Huntington's disease. Amy is a licensed social worker and the clinical researcher at the HDSA Center of Excellence at the Rochester School of Medicine in the Department of Neurology and Movement and Inherited Disorders Unit. She's also the adjunct faculty member in the Department of Psychiatry at the University of Rochester Medical Center. Amy received her MSW and her master's in gerontology from the University of Southern California in 1992. He is a marriage and family therapist who provides clinical care to people with Huntington's disease and their families at the HDSA Center of Excellence at the University of Rochester. Amy's primary research interest is evaluating and treating caregiver burden and movement disorders, and she's also the research coordinator for multiple clinical trials. And now I'm pleased to turn it over to Amy.
Thank you, Jane. I really appreciate the opportunity to talk about a subject that is rather near and dear to my heart. So as you can see from the title, I first kind of want to talk about what do we know in terms of understanding the impact of Huntington's disease in a family, and then talk about, obviously, the challenges that are associated with the things that we have come to better understand and are continuing to try to understand about HD families. And then lastly, to offer what I term some lifelines, which is essentially some recommendations and some ongoing suggestions, really how to best sort of navigate, if you will, life with Huntington's disease within your own family. So, first of all, it was suggested to me, this is actually a picture of myself with my husband and my son. I think since it's odd to be talking to people and not seeing them, that at least you'll be able to put a name and a face to who I am. And I, in particular, like this rather old quote, home is what catches you when you fall, and we all tend to fall. So I really want people to try to kind of remember this phrase sort of throughout my talk today. So one of the things, there's a lot of unique things about Huntington's disease, but certainly one of the most important is that it is an inherited disease, and that obviously plays a huge impact then on how it plays itself out within any given family. And again, this is a quote that I think is still very much relevant today. So adult children are not always aware that Huntington's disease runs in a family. There might have been a tragic story about a grandparent who was placed in a psychiatric hospital or perhaps committed suicide, but no one mentioned Huntington's. So in particular, this is the important point here, though it may pass through generations, often knowledge of it may not necessarily go along with that information through the generations. And we will talk about, I think this has changed to some degree, but this is still often an ongoing impact that families pick up different myths or false ideas about Huntington's disease. And so I think it's important to always remember that specific good knowledge about Huntington's disease may not always pass down through the generations. All right, so one of the key points today, and this quote is a little harsh, but obviously quite true. There is this sort of this viciousness, if you will, about Huntington's. So a child perhaps is going to watch it slowly impact and ultimately end the life of a parent, and then they know that they have that 50-50 chance of developing it themselves. Unfortunately, one of the big fallouts from this inherited nature is it really creates this perpetual sort of cycle of sadness and grief and sometimes suffering, perhaps not so much physical suffering, although sometimes that can be there, but this is talking more about the emotional suffering that can sometimes very much sort of weave itself through the course of Huntington's disease. And you'll see me probably continue to sort of reference the impact of this grief as people kind of move through the various kind of stages, if you will, of Huntington's disease. So let's talk about the emotional system. What, as a trained family therapist, we sort of use some of these terms, so I will try to, really try to explain them. So what is the sort of atmosphere like within a Huntington's family? And again, I guess before I proceed along, that this is not going to apply to everyone. Every family is obviously quite unique. So the things that I'm sharing today are really some broad strokes to keep in mind and to think about how they may relate to your own family and they may not relate to your own family. But these are some of the common sort of threads and things that we might see within a Huntington's family. So one thing we know is sort of the emotional atmosphere is quite different. And why is that? Well, you can see already from the get-go that we are talking about losses. And there's a lot of different types of losses that can go on within a family. Some of those are what we consider anticipatory. So in other words, if I grew up and my mom had Huntington's disease and I watched her perhaps as a teenager myself become impacted but with the changes of Huntington's disease, then I may, as I grow into my own adulthood, be able to start anticipating, if you will, some of the losses that I watched her go through that perhaps now myself I may be faced with also having to experience or to help another family member to anticipate these losses. Sometimes the losses are much more either ambiguous or what grief folks will call disenfranchised, meaning that a lot of times the losses aren't recognized sort of by the greater society. In other words, it's often hard for other people to really appreciate the impact of the loss and the grief that you might be going through, taking care of or loving someone that suffers from Huntington's disease. And in particular, losses often can be quite complicated. I think this comes up after someone perhaps has died from Huntington's disease, because often it's a long journey with Huntington's disease that sometimes folks feel like, well, once the death has come, then perhaps there's a certain amount of relief that goes along with that, and that certainly can be the case. It also can be quite complicated as well. Once death has finally come about, that people often start to sort of and look back at things they might have done differently or wish they had done differently or made different decisions. So the losses can become also very complicated at times related to Huntington's. And I outlined on here why some of these losses seem to crop up. Certainly, again, There can be a big change in the family structure of how things normally go down, who has been the breadwinner. Perhaps that needs to change with the onset, of symptoms or with diagnosis. Obviously, big changes that happen to the person with Huntington's disease, both in sometimes personality can fundamentally change. Sometimes it stays pretty close to how it was, or sometimes it becomes sort of much more kind of entrenched, if you will. And obviously the physical and functional changes of the person that's affected. In this case, I put up a parent, but obviously anyone that's affected with Huntington's disease is going to have to deal with a certain amount of functional and physical changes. And then, of course, like I talked about earlier, the final, we know this ultimately is going to cause the end of a person's life, and so that kind of final loss through death. So all of these things sort of add up to all of these different losses that can happen, and all of this is often kind of circulating within a family at any given time. So a little background just to kind of give you some perspective of sort of how typically a family therapist might think about a family dynamics, and this gives you one particular theoretical perspective from Dr. Bowen that I often rely on, and probably many a family therapist does. There's a lot of what we call a family life cycle that all families typically are going to go through, and so you can see that outlined here, and it's basically major transitions that happen to a person as they age and become older. And so first one is typically children leaving the home, whether that means through attending college or going off to some type of work or joining the military service, whatever the reason, that at some point, typically most young people are going to leave sort of their, what we call family of origin, the family that you grew up in. Typically, people may go on to then get married. Again, that's not for everyone, but more typically that might happen. Then folks may start to have children and start their own family. And then as more and more years go by, eventually that same person will start to see their own children be going off to school. Children begin to graduate, and the cycle just starts to perpetuate itself again with now your own child getting married and potentially, if you're lucky, I suppose, produce grandchildren for yourself. So that's sort of this multi-stage sort of family life cycle that's somewhat pretty typical. And so what tends to happen, or the problem, as I called it here, is that with the onset of Huntington's disease, the transition sort of between these stages of leaving home, marrying, getting employment, potentially having a family, just doesn't quite go as well as it should. There's sort of what we call the interruption, or what families often call a big hiccup that happens along this typical family life cycle. So in other words, the way we thought things were going to go starts to very much change. And sometimes this change comes about gradually. Sometimes it sort of comes blasting into the family. In particular, I think if it's an early or first diagnosis in a family, a first generational diagnosis, that often that creates perhaps bigger problems than if we knew about Huntington's in the family and now someone is getting diagnosed with that. It's still often quite traumatic and difficult, but it's a different kind of level of intensity to it. So the bottom line is that bringing in to the family Huntington's disease, whether that's through genetic testing or whether that's through diagnosis or getting a phone call that someone has been diagnosed with Huntington's disease, is normally going to upset, if you will, that normal kind of sequence of family life cycle events that I talked about. So obviously through genetic testing, the introduction of Huntington's disease or through, like I said, becoming diagnosed, what's going to typically happen is it's going to kind of upset or sort of unstabilize that sort of normal family life cycle. And it kind of throws this sense of sort of we thought we were going in this direction, and now we have to really start to kind of hopefully recalibrate and kind of start to figure out how we're going to go down now on a new path in light of Huntington's disease becoming part of our family. And there's a couple of sort of unique things about Huntington's disease that comes about specifically related, again, primarily to the inherited nature of Huntington's disease. There's a phenomenon that we often refer to what's called PreSelection. And again, sometimes this is very conscious, and sometimes it's very quite subconscious within a family, within individuals. And basically, people start to kind of believe or identify that this is a certain person that's going to get Huntington's disease. Whether they may have overt symptoms or not, that people sort of get pre-selected sometimes as that's going to be the person that's going to get it, that kind of thing. That's this idea of sort of pre-selection that can be accurate and can be completely inaccurate within a family, but it's a pattern that starts to or can start to happen within a Huntington's family. And it's often seen as a kind of a defense mechanism, as a way to kind of manage sort of the stress and the anxiety that at times can be quite striking, trying to deal with sort of the uncertainty about what tends to lie ahead with coping with Huntington's in your family. So if we take a look at what we've come to sort of better appreciate is that there seems to be about two main sort of coping ways, if you will, that families with HD tend to kind of galvanize around. One of them is certainly avoidance, and the second one is really denial. And in particular, I think there's a little asterisk here about sort of the initial stages of things that both of these ways of coping can be quite common. You know, in particular, I think sometimes if a sibling has started to go through testing themselves, genetic testing for Huntington's disease, they may then start to really try to get the rest of their siblings on board, that now they need to go through testing. And siblings can respond in a variety of different ways to that. And one of them is outright avoidance, not wanting to have anything to do with testing, not wanting to even think about it or really be involved in it. That certainly can come up. People sometimes takes a person a long time to find their way to a physician or a clinic to be evaluated for possible Huntington's disease. Families may or may not notice very subtle changes in someone, but it's very easy to attribute that to a lot of different things, whether that's just life stressors or somebody's just kind of going through a hard time, so they're more depressed. So it's very common that people have to or need to rely on sort of avoiding some of the realities until things often kind of reach a point where they no longer can be avoided, and then hopefully families can move and shift gears into something that hopefully will be a little bit more healthy for them and everyone else. And so denial is another common coping mechanism. There's actually nothing inadvertently wrong with denial. I often tell the story that I used to work years ago with a well-known geriatric psychiatrist out on the West Coast, and you know, he used to tell me that, you know, denial is not always necessarily a bad thing. I think sometimes it does have a real negative connotation to it. But in particular, I think in the early stages of things, when people are just getting news about Huntington's disease or perhaps just getting a gene-positive result or getting diagnosed or family members getting diagnosed with Huntington's disease, that people often can move into some sort of immediate denial about that. It probably, in those stages of the game, serves as a way to sort of protect them, if you will, from sort of too much information too soon and too quickly. Our hope would be that over time that people will be able to gradually sort of scoot out or move further away from their denial, because I think, again, long-term consequences of denial can really make it very hard for everyone to kind of manage. But I think there is a certain role in the beginning stages that can be helpful for people until their psyche can kind of catch up, if you will, with the realities of sort of what's happening. So I wanted to kind of focus the talk today on sort of what I called family subgroups, because that's sort of, for lack of a better word here, our terminology, but to focus in on sort of the impact on these three particular groups, because hopefully everyone falls into at least one, if not all three of these categories, or is trying to help someone that falls into any of these three categories. So I'm going to take each one individually and talk a little bit about what we know about each family subgroup and what our current understanding is about what may be going on within your own family related to this particular subgroup. So the first one is really around marriages and relationships. So what do we know so far about this? We've really started to have some more understanding. There's still a fair amount of work that probably needs to be done in terms of understanding spouses and Huntington's disease. But I particularly like one of this quote here, is that a lot of the tough emotions that tend to crop up for a spouse of someone that's married to someone with Huntington's disease is that they sort of really are quite unprepared to sort of deal with the whole reality, if you will, of Huntington's disease. And it's really hard as someone that's married to somebody with Huntington's disease to really have a full understanding or impact about what sort of lies ahead, both for myself and for my loved one with Huntington's. So for a spouse, which we typically call a well spouse, meaning that they're married to someone with Huntington's disease, it's really a lot of that unknownness that seems to create a fair amount of the stress for folks that are married to someone. And again, there tends to be a couple of patterns, if you will, that tend to come up within HD marriages. Again, not everyone is going to experience this, but it's quite common if you do or if you are. And again, these are ways to just kind of help navigate the waters of Huntington's disease. So one of them is what family therapists often call underfunctioning or overfunctioning. And in particular, this probably comes about at the time of diagnosis, but certainly later and throughout the entire stages of Huntington's disease. Sometimes spouses will start to really kind of take over, if you will, kind of doing everything. So, whether that's bill paying, organizing the day, doing the driving, sort of start to kind of what we call kind of overdo. And the typical response to that can be that the other person feels like, well, they don't need to do much of anything now. Because if you're the well spouse and you're sort of doing all the over-functioning, then that leaves my role often to be doing, if you will, the under-functioning. And sometimes it can go completely the other direction, where the well spouse will really feel like I want you to be doing everything you can possible. I want you to be fighting and battling Huntington's disease and not giving in, and I want you to keep working. And the well spouse may really start to take very much a backseat role. That's probably not as common, but again, everyone can have a variety of different reactions. But often this sort of over-functioning and under-functioning is a dynamic, if you will, that can often go within a marriage that's impacted by Huntington's disease. And certainly marital conflict. Of course, there's marital conflict in all marriages. The conflicts here tend to often center around trying to understand, well, are they doing this because of their Huntington's disease? Are they acting this way just to be difficult? But it's a lot of those questions about, well, I think they can do more than they think they can do. That often creates a fair amount of conflict within families. The person with Huntington's disease that's married to the spouse will often say they expect more out of me than I feel like I can do, that they don't seem to understand, that they don't seem to get it about the impact of my Huntington's disease. So that often can create a fair amount of strain or conflict within a family. I think well spouses sometimes feel like the person with Huntington's is perhaps using their Huntington's as kind of an excuse, if you will, at times. And it's very hard for a well spouse to know, again, what's sort of really going on here. And so those are kind of probably some of the common indicators of this conflict that can often sort of rear its head, usually at a couple of key points, in particular when people perhaps go through testing, when people are obviously first diagnosed, when people, if they're employed, if the person with Huntington's needs to stop working, that's often another sort of pivotal point when conflict can erupt. When folks are increasingly struggling to do things they used to be able to do for themselves and the family, another key point of stress. And certainly if folks at some point perhaps need to move outside of the home and live in a community care setting, that creates some new and different conflicts, or it can, for marriages. And I just wanted to highlight, this was from, you can see the Washington Post paper actually from a number of years ago from a gentleman, Dave Kendall. And this was a lovely article that was written in the Washington Post called The Vow. And you can see here, there's a couple parts to this, but he was a Huntington's caregiver out in the North Virginia area. And this article talks about the impact. This is a picture of him, obviously, with his wife when she was into the later stages of things. But I like this particular quote. So they were diagnosed back in August of 2000, and they got a gene-positive test. And his wife said, "This is really bad news, isn't it?" And she turned to Dave. She was very calm and quite dry-eyed. And this is his report then, but it was the beginning of a transformation in her. A deterioration, yes, but also acceptance, and what can only be described as grace. It was also the moment that he realizes in retrospect that she began to entrust herself to his care. And I highlighted, I thought, the really critical point on here. It was the end of married life as they had known it. Now, this is at the time of a gene-positive test, okay? The beginning of a marriage in a new form. It was the same contract, but now we had radically altered circumstances. She had put her life in my hands. And so I think it's quite striking how he can see that that shift started, and this started quite early in his mind. And sometimes that very much is the case within a marriage, and sometimes that awareness of the shift happens much later on. So here are some thoughts in terms of the marital conflict. And again, we generally define this when sort of neither spouse will sort of yield to the other. Again, you're going to see this more commonly during the early stages of Huntington's disease when both people are really trying to acclimate to what does all this mean and sort of what's the new reality. I did want to highlight that spouses, when someone is newly gene tested, the well spouse often has almost no support at times. So much of the focus is on the person that got the gene positive result, that this is really a time when well spouses really need to be reaching out to getting their own support as well, because chances are there is a lot going on for them in addition to the person that got the actual gene positive result or got a diagnosis of Huntington's disease. Again, as household responsibilities start to shift and financial difficulties may start to crop up, we're going to tend to perhaps see more conflict that's going to arise. Two of the hardest things often to cope with is the mental deterioration of the person with HD and obviously the fear of passing the gene on to children. And again, some other things